Good morning and welcome to Womack Medical Center Women and Newborn Care Unit. This is where you will be coming over on the catwalk from L&D after you have your baby. This is where you will stay for the remainder of your maternity stay. I'm going to show you one of our rooms that we use that you will be staying in. This is one of our standard rooms. As you can see, it has its own bathroom with shower, and all of your bathroom supplies will be in there. We will provide you with pads, panties, chucks, diapers, wipes, all that kind of stuff. So unless you have specific supplies that you need yourself, that we will give them to you. However, if you want shampoo and conditioner and specific bath soap, stuff like that, please make sure that you bring them with you yourself. You will have extra hospital gowns, a bathrobe, towels, anything you need. More than that, you can bring with you. You can be in your own clothes whenever you want, and you can have the baby in their own clothes whenever you want. So make sure that you bring things that you're going to be comfortable with while you're here in the hospital. So this is a standard room. We have a crib for the baby, and the crib will be diapers and wipes and extra linens and stuff like that if you need them. If you need extra linens for the bed or anything like that, you just let us know, okay? When you come into the room, you will get roomed in by your nurse. You will get a packet that goes over your entire stay. Just to briefly go through it, the first couple of pages are basically everything we're going to talk about while you're here. It goes over visitation policy and signs and symptoms to call your nurse for, safety, all that stuff. What's important though is always be keeping track of your feeding logs and your diapering logs. We do have lactation consultants on the unit, and they are able to come and see you and help you with breastfeeding if that's what you choose to do. We are all experienced with breastfeeding, and we will be helping you throughout your entire stay if you choose to. However, if you want a formula feed, that is great also. In this packet, there is the birth certificate worksheets. What you will do with these is you'll fill them out as completely as possible and turn them into any one of your nurses or any of the staff, and they will be picked up by a patient administration department. From there, they will give you, they will come and they will contact you about the rest of the process, okay? Because the process has changed greatly now recently. Also in this is a new parent support group form that is also required before discharge. We have you watch a shake and baby video before your discharge. It is MedCom mandated. So we just have to have you fill this out so that you, like your attendance has been noted, okay? Also in this is information about what new parent support does on BRAG. And then there's also some information on the PEDS clinic and if you need assistance after you've gone home. Every room is private now. We don't share rooms anymore, which is good. You have your own bathroom, your own space, your own TV. When you come in, you will get a list of the TV channels and a remote. You will also get a menu for a congratulatory meal that every new mom gets after they have a baby. You use that, you call the dining area, the dining facility at 8 Dine, and you let them know that you want your congratulatory meal. You have that meal either for lunch or for dinner, and it goes through a whole specific menu. Your support person can share that meal with you, but it does cost $6 in order for them to order it. It comes with little wine glasses and some apple cider, sparkling apple cider. It's kind of cute. We do have nutrition rooms. However, at this point in time, anything that's in the nutrition room has to be gotten for you by the staff, but they do have snacks and drinks, ice water, juices, ice pops, stuff like that. You can also bring in your own food from the outside if you want. Just make sure that it is nothing that's going to cause a safety hazard for the unit, okay? Also, things that you should not bring with you to the hospital are candles that have open flames, weapons, alcohol, any of your home medication. If you have home medications that you need to take, leave them at home, let us know, and we can get you those medications while you're here. Visiting hours right now are limited because we're only allowing support people. So Dad can come and go as much as he wants at any point in time. He's just required to keep the band on that was banded for when the baby was born, okay? So Mom will have a band, Dad will have a band, and baby will have 2 bands, one on an arm, one on a leg. These are all required to stay on at each one of these people while they're here in the hospital. Also, the baby will have a security band. That is this big yellow chunky band attached by this elastic. It goes around one of their legs. If you open this band, it's going to alarm and security will come. Okay, so part of our security measures is that everybody that works here has a pink badge. If you come in and somebody comes in to get your baby and you cannot see their pink badge, ask them to see their pink badge. If they cannot produce their pink badge, then do not let your baby go with that person, okay? Nobody is going to be offended or get their feelings hurt if you ask to see their badge. Also, if you're out and walking about in the halls, like we encourage you to do 3 times a day, the big chunky yellow bands on their arm are going to lock the doors and the exits if you go too close to them. So we just ask that you don't stop and talk in front of the doors. Also with up and ambulating, everybody is required to wear a mask in the halls at this point in time. So that's important that you bring your own cloth masks with you when you come, just for your own comfort. We will be checking on you at least every 3 hours. These are called purposeful roundings. We will be making sure that you do not need for anything and you're not having any pain issues. You can be rounded on sooner than that. It will be requested of you, asked of you when you get here, how often you want to be rounded on you. The least frequent we can do it is every 3 hours, but we can round on you every hour. But that is a personal preference to you. However, unless you have things going on that you need to be rounded on sooner, like if you're a fresh C-section, we're going to round on you hourly because that is what is required of us. So a C-section stay is 48 hours. A first-time mom stay is 48 hours. If you've had more than 1 child, then your stay on our unit will be 24 hours. That's from the time of delivery, not from the time of admission to the hospital. However, if you had your baby late at night or in the middle of the night, then you often have to stay the night until the next day when the pediatricians and the doctors can come in and see you and round on you. When you are discharged, we will be providing you with your medications at that point in time, so nobody has to go to the pharmacy or leave the unit in order to get those medications for discharge. They should all be there. In the packet, it goes over the hours for the grab and go and for the cafeteria. Dad is responsible for providing his own meals while he's here. You will be required to have a car seat on the unit at time of discharge. If it is a big, chunky, convertible car seat that grows as baby grows, leave that in the car because that's very heavy to carry out, but make sure you tell your nurse that is why you haven't brought your car seat up. If it is a regular handle car seat, you'll be able to bring that up, and then we'll do a basic car seat check before you leave. The car seat has to be the appropriate size for the infant. It has to not be 5 years old or more than 5 years old or not have any recalls on it. If you have a baby boy, the pediatrician will come in and go over your choice of circumcision if you want it. If you do not, there will be lots of education regarding this before and after the circumcision occurs in case you wish to have one. We have a rapid response team at Womack, and if you call this phone number from the room phone, you will get a doctor, a respiratory therapist, and a nurse. They will come and set a second set of eyes on you. What we ask is that you give us a call first, and if you feel that we do not respond to your issues or your questions appropriately, then you call and talk to them and make sure that you are getting what you need, okay? We just ask that you call us first. Also, on channel 62 is a newborn channel that is got a lot of good information on it. It has lots of videos about breastfeeding, about pumping, about swaddling, baby care, all that kind of stuff. So that's a very good thing to watch, especially for people who haven't been new moms or who are new moms. We always encourage hand hygiene. There is alcohol sanitizer in the rooms and sinks in the rooms. Everybody should be washing their hands after they use the bathroom, cough, sneeze, and definitely always before they're touching the baby. Now, concerning the baby, we do some screenings before the baby leaves the hospital at the 24-hour mark. We will do a jaundice screen, a metabolic screen, a congenital heart screen, and before the baby is discharged, a hearing screen. The metabolic screening is a state mandated by the state of North Carolina. There's a paper in your packet that you need to fill out. You just fill it out as complete as possible, turn it into the nurse, and they will take your baby's blood. It's 5 little pokes of blood, drops of blood on a piece of paper. It goes out to the state of North Carolina. If you never hear back from them again, that is awesome. If you do, they usually want to retest, and then they will help you deal with whatever positive results you come back to. Congenital heart screening is very non-invasive. It's a pulse ox on the right hand and on a foot. It's just to see the oxygenation blood flow of the baby. Hearing screen, very simple and easy, and that will be explained to you as you go through. For safety and security of our infants, mom is banded, baby is banded, and the support person is banded. The support person can be your partner, your spouse, your mother, your father, whoever you deem to have with you while your baby is born. We put a band on each adult's wrist and a wrist and a leg of the newborn. These need to stay on at all points in time. They link you to your baby. So do not take them off to take a shower. Do not take them off when you go home. This is how we verify that we are bringing the right baby back to the right room. This is the chairs that we have for the support person to sleep in, okay? You just ask for linens from the nurse or the staff, okay? Pull out with the handle, lift up. It should be completely even. Pulls out all the way, and then this top part folds down. This is the nursery. This is where we bring babies for their 24-hour testing, for exams, for weights, hearing screens. If any procedures have to be done on the babies, they occur here. Baths. This is the whole length of the unit, so we encourage you to walk the whole length of the unit around, at least 3 times a day, up and moving around, so that you're kind of get back to feeling like normal. So this is the main nurses station. If you want to order out, they are still accepting takeout orders. You just have to go downstairs and meet them by the AOD desk. We do have a book full of menus here. If you have any questions or concerns, there's always somebody here. This is where your call bell rings. This is where the main charge nurse sits, where the phone rings. So if you need anything at any point in time, you can always just come out and ask here if you don't pick up your call bell and call us. This is the circumcision room. This is where your little boy comes to have a circ if you request it to happen. It's usually done by the physician and, well, it's always done by the physician, but they have an assistant. It could be one of our CNAs or one of the residents, but this is where that procedure takes place. So this is the main entrance to the unit. Okay, when you're coming in and out, you'll be asked to show your white band. You'll press the button. When you press the button, you'll hear a beep, and you'll hear one of the MSAs tell you to push the door. You have to wait for them to tell you to push the door. Thank you. And you have to do the same thing when you're coming in from the outside. So there's a call bell there, and she'll tell you to push the door. If you hold this door open for too long, it will alarm. If you try to push the door while it's locked, it will alarm. Of course it's not. If you keep on doing that, it will continue to alarm. That is another part of our security measures to help keep our babies safe. We have visitor restrooms on the unit, and we also have water fountains if you need it, but we also have ice and water in the nutrition rooms.